We're now going to move on to look at what we as ReMO understand as mental health, and give you a little bit of background in terms of what we already know. So within the network, we're using the WHO definition of mental health. And that's clearly that mental health is more than just the absence of mental disorders. It's a state of well-being in which people can realize their abilities, they can cope with the normal stresses of life, and can work productively and are able to contribute within their communities. So mental health is determined by a range of socioeconomic, psychological and biological factors, and it can vary over time in that most of us will experience a period of poor mental health sometimes in our lives. So, I mean, it's certainly not an unusual situation. And poor mental health is associated with rapid social change, which we're clearly going through at the moment, through stressful work conditions, gender discrimination, social inclusion, exclusion, unhealthy lifestyles, physical ill health, and human rights violations. And today within academia, I think certainly most researchers are experiencing some of that. I hope nobody's experiencing all of those experiences, but clearly there's a need to raise awareness around mental health and well-being for researchers. And there is, in fact, growing awareness of mental health issues within academia. We're seeing far more articles, blogs, published papers around the challenges around mental health, particularly at the early career stage. And much of the momentum that's currently going on has been informed by Katia Levesque's seminal paper around mental health problems in doctoral candidates, which is a survey that she conducted within the universities within Flanders. And if you haven't read this paper, I strongly encourage you to get hold of it and read it. I mean, the main message coming out of this is that a third of doctoral students are at risk of developing some sort of mental disorder, which is more than double the normal comparable population. You know, so clearly there's something going on within doctoral education that we need to look at in terms of ensuring the mental health and well-being of our doctoral researchers. And there's increasing evidence that that's also happening at an early career, at postdoctoral level, and within the academic community more generally. So here's another report that I suggest that you read if you want more background in it. This is a review of the literature in mental health within the research environment that was done by Susan Guthrie from RAND on behalf of the Royal Society. And what's coming through from the existing research in this is that higher education staff report worse well-being than those in other types of employment, and that they find their jobs more stressful compared to high-risk groups such as health care workers and prison workers and armed forces. That PhD candidates face specific challenges around high levels of work demands and work-life conflict, poor control over their jobs, poor supervision from, poor support from supervisors, and exclusion from decision-making. There's also low levels of disclosure of mental health conditions by academics, and I think this has challenges for researchers to be able to see role models and to be encouraged to talk about their own levels of mental health. Job insecurity was seen as a key issue in terms of the mental health, and we know at early career stage that this is getting even more critical, particularly at the postgraduate stage. Gender is a factor that's merged as a determinant for mental health within researchers. Spending more time on research is associated with reduced stress, and I think that's in comparison to the pressures on on providing teaching and other service or administrative duties. So that stress and not being able to give as much time to your research as you'd like to. It's also the productivity of researchers can be impacted in terms of their well-being. And we see the impact. We don't see much impact in terms of the stress on the job satisfaction of researchers. And we certainly Vitae sees that through all of the surveys that we do, is that irrespective of the working environment and researchers basically love doing research and are happy to have the opportunity to do that. And in some ways that level of job satisfaction is not helpful in terms of making more noise about mental health and well-being. And then finally, there's evidence that mental health interventions can have limited impact on this. And I think that's particularly important in the academic environment, because so many of the issues that we see that are impacting on mental health and well-being are systemic issues. And they're integrally tied up with the reward system within academia, within that need to publish or perish, or to get grant income in order to sustain your research activities. And that's why we've created this working group that's specifically looking at policy level initiatives within mental health, because we need to work at that systemic level in order to create that environment where researchers can flourish. I don't think there's any value in implying that if the researchers have more resilience, and we hear this message all the time that, you know, people are being, oh, if you're more resilient, then you're more able to cope with the environment. I think it's unacceptable that we expect people to be able to cope with an environment that clearly isn't healthy. So what can we do to change that? There are things that are happening. To give you an example, to just look at what's happening at a systemic level within the UK. There's a lot of activity that's going on, and we do have a lot of momentum going on. We're very fortunate that in the UK, mental health is very high on the agenda in terms of societal discussions. In terms of public recognition of it, we've had a lot of support from Prince Harry and Prince William and Kate, in terms of how important it is generally for the population and children in particular. So there's already that conversation going on within society. At a university level, we've had a series of very high profile undergraduate suicides in the last few years, which has raised awareness within higher education. And Universities UK have introduced a step change framework around mental health at universities. And although originally this was targeted at undergraduates, it's recently been revised to look at a whole university approach. And so it includes actions around supporting the mental health of academic staff. And that will include researchers as well. At the postgraduate researcher level, Katya's paper in 2017 prompted a review by the government in terms of what's the situation in the UK of mental health and well-being of doctoral researchers. And Vitae and Katya conducted a report into what associated support is currently happening within UK universities for our doctoral researchers. And that's resulted in a £1.5 million worth of investment in a series of 17 projects that were undertaken by UK universities to develop resources and interventions that can support postgraduate researchers. And then finally, and it's very much related to mental health and well-being, is a lot of work around the research culture and how do we improve the environment and systems within the research ecosystem. So this has been driven in terms of how can the UK stay world leading in terms of research outcomes? How do we continue to attract world leading researchers, particularly within the context of Brexit? And there's an understanding at government level that the research environment is an important aspect of this. and so that healthy researchers produce better research outcomes. We're also seeing a lot of initiatives around research integrity, and Vitae recently did a study in terms of the landscape of the barriers and drivers that impact on research integrity. And what came out of that study is that many of the issues that are impacting on mental health and well-being are also impacting on the ability to have high levels of research integrity. And we find that the positive interventions around research integrity, such as code of practices, research integrity committees, the Concordat for research integrity, are fairly weak against the drivers that are systemic within the research system, such as publication, the pressure to publish more and more papers, the pressure to publish in high impact journals, and the reward system being based largely on those measures is challenging individual researchers' levels of research integrity. So there's been a move to sort of draw these initiatives together in terms of the healthy research environment should be about both mental health and well-being, but also research culture. And we're seeing that reflected in many of the strategies at a system level. For example, UK Research and Innovation, which is the combination of all our public funded research councils, they have an action plan within their strategy around supporting mental health and well-being. They have policies around tackling bullying and harassment. The Wellcome Trust is doing a huge project upon revitalising the research culture, which has included a recent survey in terms of what researchers think about the culture that they currently work in. And that looks at well-being, mental health, bullying and harassment, and levels of discrimination. Vitae has produced a well-being lens on our researcher development framework in terms of looking at how researchers can stay healthy, and we've been providing resources for supervisors and researchers in terms of how to have more open conversations around their own well-being and mental health. And then finally, all of this has been incorporated into our Concordat to support the career development of researchers, which has been the equivalent of the European Charter and Code. But it's now been relaunched and revised in last year, September last year, and it now consists of 3 basic principles. One on the employment conditions for researchers, one on the professional development that we need to provide to support researchers, but the third one is very much targeted on the research culture and environment. And contained within that Concordat are obligations on 4 of the different stakeholders, on funders. And funders signing up to the Concordat have to consider how their funding opportunities and policies can facilitate better well-being and mental health of researchers. And I think that's a fundamental part in terms of how do we change the system, is how do we change research funders' mechanisms by which they evaluate and allocate grants and funding to researchers. There are obligations on institutions in terms of how they support the mental health and well-being through management of workloads and management of people, effective practices for tackling discrimination, bullying and harassment. There are actions on research managers in terms of how do they support the researchers that they line manage, and how do they create a healthy working environment through both their working practices and being role models for other researchers. And how do researchers themselves take positive actions in terms of supporting and maintaining their own well-being and mental health. And I think it's important that this issue is tackled at all of those levels, that we bring all the actors together to bear. And that's one of the reasons why ReMO has set up the 3 different working groups in terms of what can we do at a systemic level in terms of bringing together funders, policymakers and other stakeholders. What can we do at an institutional level to support institutions to implement good practice in this area? And what can we support? And what can we support? How can we support individual researchers through Working Group 3 to support both their own individual mental health and the mental health of their colleagues? So if we look specifically at Working Group 1 in terms of systemic issues, the aims and the objectives of our working group is how do we address mental health at a system level by bringing together researchers, funders, and policymakers. How do we bring together an evidence base on the prevalence of poor mental health and characteristics within the working environment across Europe, and understand how these differ by different roles, so at different levels within the research environment, also context, like what are the differences in different countries, what's the level of understanding and the acceptability of being able to talk about these issues, and what initiatives may be happening at country level that could be of value in other research environments. Excuse me. And what actions can we take at a systemic level within our network to improve the mental health of researchers with regards to practice and policies. Okay, so in terms of the initial thoughts that we've had within our proposal, which clearly as ReMO is a bottom-up initiative, we need to discuss and agree within our working groups whether these are appropriate and what are the specific actions we're going to do within this. We're proposing that we contribute towards developing a ReMO manifesto. So that's what concrete actions that we're going to take over the next 4 years to move this agenda forward. We're proposing that we map the European and national landscapes so that we understand the current landscape of the mental health and well-being of researchers. And we're very fortunate in this network that we already have 31 countries or members. So we have individuals that are already situated within these countries that we're hoping will bring to the network what's happening in their own individual countries. And we have over 130 researchers who've already signed up to the network that can sort of help us with that. And then we want to look at what actions can we take to raise awareness and engaging with policymakers and funders so that they understand the importance of their actions in terms of changing the systemic issues that are impacting on mental health and well-being. So we're now going to move forward in terms of what those actions look like and how do we change them into concrete recommendations by doing a SWOT analysis. So hopefully you're all familiar with SWOT analysis. It's looking at internally, what are the strengths and weaknesses that we have within our network? So what do we bring as individuals and collectively that will help us on this? What are the weaknesses within the network that we need to be aware of and look to see how we can minimize those? And then what's the external environment that we have in terms of the opportunities we have to make a difference? And what are the potential threats that will stop us doing that? We're now going to do this in terms of small groups. And if you would like to either use the QR code or put this link in terms of your, through your own, click onto this link, which I think Brian should have put into the chat so that you can pick up the link directly from that. What you'll find is a little Padlet, which you can post. Let me just get that example of that for you. So there's a little Padlet there where you can add comments to in terms of your thoughts of the strengths, the weaknesses, and the opportunities and threats that we have within our network. Brian is going to, again, randomly allocate you to different groups. So, have some conversations about what you think they are, add your thoughts to it. You'll be able to see the thoughts that are coming through from all the other groups as well. which you'll be able to add to if you'd like to.